Welcome to Medical Minds. Once again, I'm Teacher Zita, hosting Dr. Andabati. Please say hello to our viewers who are wishing and willing to ask you a lot of questions today.
Yes, good evening, viewers, especially the men.
Yes.
So you're most welcome to join us in the discussion.
Thank you so much, Doctor. Our topic of discussion today, infertility in men.
Yes.
What is infertility in men?
Yeah, so we talk about infertility in men, specifically when a couple fails to get a pregnancy in 1 year of trial, and you have found out the problem actually is in the man.
Okay.
Yes.
Okay, that's very good.
Yeah.
How does one know that they are prone to infertility? How can a man know that it seems I am infertile?
Yeah, so unfortunately, apart from the fact that you have to wait for the 1 year of trial, and then you don't get a pregnancy at all with your wife, and then you get to know. There is no other way of knowing. The rest is usually looking at the causes.
Okay.
Of course, there are a few other situations, for example, when you have problems with erection, you know, if the man has a problem with erection, or is having issues with ejaculation, those ones, they can be able to know.
To know that they are.
Yes.
Okay.
But apart from that, the rest has to be worked out from the health unit.
Okay, someone called me yesterday, and because I told them that we're having this topic, then it was like, can you please ask doctor, is the size of my male reproductive system determining my fertility or infertility rate, something like that? And I was like, how old are you? He was like, I'm 19 years, but it looks like for a baby of 10, 11 years. I was like, okay, I'll ask doctor. Does that determine that?
The answer is yes and no, because there's the normal size of the penis, it varies depending on whether it is in erection state or it is in a flaccid non-erectile state.
Okay.
This is one. But if the size is small, extremely small, when it is not in erection state, it could be a sign of an underlying problem.
Okay.
Yes, so it is possible, but it needs to be evaluated to see whether it's that. So it cannot be ignored, but of course, by and large, and also among the normal ones, there's a big variation, you know? Yes, like how people's sizes are, others are tall, others are short.
Yes.
It doesn't mean that they have an abnormality.
True.
Yep.
Let's look at the possible causes of infertility in men. Last week it was women. Today it's men. And yet to a larger extent, men think the fertility issues are for ladies. So today we are talking about men. We want to look at things that could be causing infertility among men. Yes, doctor.
Yeah, so well, before we look at the causes, actually it is not only men who think infertility is a problem of women. Even some women think it is their problem.
It is our problem.
Yeah, see, when a couple fails to get a pregnancy,
they think it's the lady.
The lady herself even thinks
because women we are fast, so and so is the saying.
So it is like a general problem. People think the problem is usually in the woman, and incidentally that's not really true. Okay. Because what we know is that in about 30% of the cases we see the problem is in the man. Actually, it is distributed equally, because we know in the 30%, that is 3 out of 10 couple, the problem is actually in the man. And 3 out of 10, the problem is in the woman. About 2 out of 10, we don't get to know the problem. In about 1 out of 10, the problem is in both. Yeah, so it's quite common actually. The problem in the men is common. Okay. Yeah, so the problems are actually numerous. Okay. They are quite numerous, and they can range from problems with sperms, abnormalities of the sperms. Those are hidden, and you have to look for the sperms to understand.
And sometimes you might not know.
In most cases, you will not know that
you
problem.
Successfully have intercourse.
Yes.
And then you also release
exactly. Yes. And then that
but
fluid
you fail to fertilize.
Yes, that fluid you release is supposed to contain normal sperms. So in terms of numbers, in terms of shapes, in terms of their ability to move, in terms of their ability to fertilize. So the abnormality could be with the sperms. We will look at some of those. Yes, so there are several abnormalities which can happen with the sperms. For example, a good sperm is supposed to be very nice and healthy like this. It has principal key parts like this, the head. This head is very important because here it carries the genetic material. And then it has a neck, which we sometimes call the middle piece. Now this has these things here. We are representing the energy source. So this is the one which provides the energy for the sperm.
It pushes it further.
Yeah, it gives it is the energy. It is the generator actually. It's the energy source for the sperm. And then down here is the tail. Now these are supposed to be in the same in a specific shape and in a specific size, like this. So abnormalities can occur in the sperm's head. For example, here we have abnormalities of the head, small, tiny head. So it is so small that it might over squeeze the nucleus, or things here, other things may not enter, like this one in front. And or it may be too heavy, too big, so it can't carry it. Or the whole sperm may be small entirely, or the head may be double, both of them, two heads.
So that two-head one is, what is it? Is it a twin? Is it a, what is that?
Now that is not a twin, that's an abnormal sperm. It will not fertilize. The egg will not accept it to be fertilized. These are supposed to be two sperms, but they failed to separate. Yes, so, but they cannot work. Or the head may be completely amorphous like that.
Funny.
Yes. So the problem may also be in the, so there are so many problems. It may be in the part which is generating the energy here, the neck. So it can be twisted, or it can be bent, or it can be swollen, it can be completely absent, or it may be too long, or it may be
too short.
Too short, yes. So all those are there.